After Exposure, Asbestos and Mesothelioma Stories, a podcast from the Mesothelioma Center at asbestos.com. On this episode, we discuss the push for an asbestos ban at a critical moment. Your host is Missy Miller, Director of Medical Outreach for the Mesothelioma Center.
Welcome to our podcast. Today we're discussing the push for an asbestos ban at a critical moment. We're pleased to welcome Linda Reinstein, the president and co-founder of the Asbestos Disease Awareness Organization, otherwise known as ADAO. Linda, thank you so much for being with us today.
It is a pleasure to join you, Missy, for this informal, just kind of a chat. I'm looking forward to it.
Absolutely. We love chatting with you. For those of you who don't know, I've known Linda for over 15 years now. When I first got started with asbestos and helping patients with mesothelioma as a patient advocate, Linda was one of the first conferences that I ever attended. I was completely inspired by what an amazing advocate she is for other patients who have been diagnosed with mesothelioma. So I would love just to ask you a couple questions and we can just kind of have a short dialogue if that's okay with you.
I love that approach.
Okay, perfect. So what led you to founding ADAO and why was it necessary at that moment?
So asbestos came as a total shock to Alan and to me. We always thought our air, water, and soil were free of contaminants. We were deadly wrong. So when Alan had a slight persistent cough, which led him to doctors and ultimately invasive surgery to diagnose that cough with mesothelioma, it opened Pandora's box for me. And Alan's treatment was the top priority. But as you know well, Missy, when you start discovering what methodology you might want to consider, you start uncovering 100 plus years of facts that confirm asbestos exposure causes suffering, disease, and oftentimes deaths. So that was really the first introduction to asbestos. And Alan and I had a unique approach. Our daughter, Emily, who you've met, Missy.
Yeah, Emily's fabulous.
She's 33 now.
I know, she's gorgeous too.
She's an amazing woman. I'm very proud. Thank you. But when Emily was just 10, Alan had that cough, which ultimately required surgery to diagnose him. And then you had to evaluate treatment options, as you know. So the more you look at treatment options, they're really barbaric, from trimodal or back to go fishing, nothing at all. So I think determining what course of action for Alan led me to opening up this box of information I wish I never had been selected to know about. And that's what started the big quest. And Alan was very strong with what he wanted, which was more time with his family. And when he was starting to feel better after his EPP, extrapleural pneumonectomy, Emily and I went to Washington, and that was the real personal discovery of what was the problem, what is asbestos, what do you do, and of course, what's the next step? And that's when things really started going for me. So I met Doug Larkin, who co-founded ADAO with me.
Yeah, I had the pleasure of meeting Doug as well. He was a remarkable man, and I'm sorry for your loss with him.
Yes, Doug died of ALS in 2017, and he was
very, yeah, super sad. I'm happy that he was able to help you co-found such an amazing organization, and it's great to know that Alan's diagnosis, although very sad, really helped kind of shape you and Emily's experience and your approach to how you felt advocacy should be used for helping other patients who get this illness. Did you find any gaps existed in education or advocacy in the community support when ADAO began? And do you think that still remains today?
Yeah, that was one of the biggest impetus for starting ADAO. And Doug and I used to talk about that. It's like we got dropped off on the bottom of this steep climb with a learning curve that was unmanageable, and we didn't know what to do. So knowing what we had gone through personally led us to the fact that asbestos should be banned. Why should anyone else go through it? So the gap of learning was not just about prevention, but it was about treatment. And that was the time, Missy, that I realized storytelling was so important. I'm not a lawyer or a lobbyist. I'm just a mesothelioma mom and now widow. And when we first went to Washington, Emily and I remember like it was yesterday, I put this picture on the table for our meeting, and it happens to be Emily and Alan. I think she's about 8 or 9, dancing. And I used that in our meeting, saying that because of mesothelioma, Alan and Emily might not be able to experience that father-daughter dance. Of course, Emily's in the meeting, so I'm being careful as a mom, but I saw their body language and their emotions start to come to the surface.
Yeah.
And that's when I realized it's really through shared stories that you can try to communicate this virtually invisible fiber to the reality that prevention is the cure.
Yeah, absolutely. And you had created a book too, sharing stories, which I thought was very inspirational. So thank you for bringing that to other people who are exposed to asbestos and do get this cancer. I think that your book is fantastic. Do you want to say anything about the book at all?
Yeah, sure. So thanks for mentioning. So the book, I curated that book a couple years ago. I think it was for our 20th conference. And what I found, and you might have found this too, Missy, is that everybody has a story to share. Whether it's Alan and Emily taking that father-daughter dance, or a veteran who served our country bravely, or a young woman who might have used talcum powder that's contaminated with asbestos. We all have shared stories and they impact our lives. So thinking about the power of storytelling and what ADAO has done, it felt like the right thing for me to do, to curate the book with over 200 stories so that people could really understand who we are, what we stand for, and what we do, but even more importantly, how we were impacted. I think you might recall, Missy, in the book, there are small white doves that I put in the corner of some titles because people have, over 20 years, people have written a lot of stories to me. And if somebody passes away, it was never my right to change anyone's story. So
Mhm.
I used the dove to note the person was deceased. So it's a collection of stories from patients, decedents, and their families about how asbestos impacted them. It's a powerful tool. I still take it to Washington and our conferences because it is through our shared stories that we can move towards action, which is prevention and policy.
Yeah, absolutely. And I also feel that it brings awareness for people who feel so very alone that, they aren't really alone, that there are other people who have gone through this and have suffered, and that, asbestos should be banned. And we do know that as Global Asbestos Awareness Week comes, which will be April 1st through the 7th, what do you want people to know with the Global Asbestos Awareness Week? What do you want the world to understand most clearly about why this is such an important week?
Well, first off, I think you touched on it. We don't ever want to be alone.
Mhm.
The tagline I use is one word, one week, one world, bringing people together. If you have suffered or you've lost someone, or maybe you're in a labor union, not being alone is really important. Before I talk about the elements of the week, I think your viewers might appreciate or want to join in on. When you talk about being alone, Missy, it is a real part of the disease, like the treatment. The family members are often not part of the treatment circle. It's the patient only. And I remember with Alan's treatment and surgeries and recovery and all the other elements he endured over 3 years, is in the very beginning, I went out to my garage and I sat on a brown box and the lights were off and I just cried. There was not enough fuel or information to help me personally, and that feeling of isolation was paralyzing. I remember I'd come in from the garage, that was like my alone therapy session, right,
Mhm.
crying, and Alan said, "Honey, what's wrong? Your eyes are all red." And I'm like, "Oh, no, don't worry. I must have gotten something in my eyes." But I would always try to cover that emotion because the patient is 100% focused on their care, as they should be. And oftentimes the family and community are left behind. So I think
Yeah.
isolation is huge. That was really why I started the resolutions that designate in the U.S. Senate. They designate April 1st to the 7th as a week of awareness. What's easier than that? And every member of Congress has to vote yes for the resolution to pass. That means unanimous consent.
Mhm.
I've had to make some phone calls along the way over the last 20 years, calling up members to remind them that they voted for it last year. But
Right.
that being said, they always come to the table. And education is like apple pie. We all know it's important. So awareness and education go hand in hand. And the week has really expanded to, I'm really proud of it. The week has expanded dramatically. It'll be
Mhm.
our 22nd week coming up. So we highlight some of the shared stories. We have quotes from leaders and the firefighters and many other experts. There's always a call to action. And Missy, you're always so great at helping me with ADAO to share. Maybe it's sending a letter to Congress or something else. There's 7 of them. And there's usable information. When I first started this week, actually started with a day, and then 3 years later to a week. I used to have to pay to have things translated and to write press releases and share them. And now with technology, it's a whole new world. So
Yeah.
we translate our videos using AI in 6 different languages. Our press release also coordinate to the languages. So we
Mhm.
do it with French, Hindi, Russian, Ukrainian, Spanish, and Portuguese, so we can reach a broad part of the world that has been possibly involved in mining or imports and exports. So the information should be accessible, usable, and something that is easily translatable. And everybody's a part of it.
Yeah, absolutely. I find it shocking because every time I have conversations with people, everybody thinks that asbestos is actually banned in the United States, and they're shocked to hear that it's not. And I know that ADAO has built over 20 years of evidence-based advocacy in the US and globally. Do you want to talk about that and all your evidence-based advocacy that you've had to share with the world?
Sure. Thanks for asking. So when I went to Washington with Emily for the first conference, I'd be standing in line for a Starbucks and they'd say, "Oh, are you here for a school tour?" And I'm saying, "No, we're here to talk to our senator." Then I stand in somebody else's line and they'd ask a question and they would offer up like asbestos. That happened to Uncle Harry. That happened
Mhm.
to my mom. So learning along the way and connecting the facts have been monumentally important. I can tell you all the facts from different registers, like there's 50 years of knowledge over there on my desk. We can talk about facts and stats all we want, but
Yeah.
if you can't connect the human story, you lose their attention. And I think that's what I'm most proud of is that we have been able to blend cutting edge science and policy to tell the story about the impact of asbestos, but not just to cry about the millions of lives lost, but to look forward and embrace education and prevention. I
Yeah.
believe in research for a cure like you do, Missy.
Mhm.
When Alan was first sick and diagnosed in 2003, the cures and treatment from then to now haven't really changed that much. So
No.
prevention, as I always say, while promising research continues, prevention remains the only cure. And this week allows us to talk about prevention in different languages, different modes, and together as one.
Absolutely. And prevention is the key. It's really not the treatment process. And I love that ADAO's work is based around prevention so people don't have to get the treatments. So I think what you do is something that's very needed. And we can't thank you enough for the role that you share in helping all us citizens here in the United States have a safe haven, so to say, where maybe at some time in my life I'll see that asbestos has been banned. We had talked a little bit about the shared stories and how they play in connecting the data and the science and the human impact. Is there anything else that you want to talk about with the shared stories and connecting it all, or you think we've covered that?
Well, I think people have an idea of how our stories shape prevention and policy, but
Mhm.
what people may not know is the undercurrent is really strong and fast. When industry finds out this collection of stories exists, it's harder to push back. And I think that's what's made ADO's work as a leading stakeholder in the conversations makes us industry can identify ADO as a true leader, and I'm proud together with Science Advisory Board, Prevention Board, General Board, we have led, but industry doesn't push back like they once did. The facts are irrefutable. And I think for anybody viewing this podcast, it's really simple. Asbestos is a known human carcinogen, and there's no safe level of exposure. So we want people to understand that. And those elements, whether it's a fire or tornado, rain, we all have to embrace those basic facts, or you just get lost in the chaos. And oftentimes the chaos is designed chaos. Like if you can spin people silly, then they're so confused because doubt
Yes.
has been the product. The merchants of death in the 70s and 80s, it was doubt. And I love combating doubt. I like to be the real girl at that table talking truth. And then when they look confused or shocked, I pull out the science and the papers and and then they're like, oh no, we can't go back. So I have an arsenal, obviously, after 20 plus years.
Absolutely.
Yeah.
How do you guys plan on educating the next generation of public health advocates and policy leaders and law students? Do you have a plan to help educate the next generation?
Well, I'm striving for a plan. So 20 plus years, I've had interns work for me here, and with COVID, now it's remote. So
Yeah.
I bring on interns so they can learn from the ground up. And it's confusing, right? You're talking about a nearly invisible fiber that can kill you in, 6 months to 3 years or more. And so it's a hard issue to understand. It's clearly not the sexy conversation at the bar, but the kids come on and they learn. Most of my interns have gone on to be lawyers, public policy people, communication. So I love to bring students in to sit right beside me or remotely to work. But also, after 20 years, I can create a dynamic conversation with evidence to talk to law students and others. And most time in universities, and most times I see students, I always have a lively Q&A. And they're like, Linda, how does this really happen? So understanding like the big why is also important going forward because young students recognize this is wrong. They
Yes.
truly recognize it's wrong. And they want to be part of a fight. And if you think about like organic food, you go to a market, maybe it's Whole Foods, maybe not, but things are marked and you can identify, make good choices. And with asbestos, it has been really the invisible killer. So looking at how the millennials process has led me to develop course structures where I'm an invited speaker at a university. It's really exciting for me. And I've gotten interns from that also. So I think training the next generation of leaders is important. I turned 70 this last December.
You don't look it. You do not look it at all.
But if you ever have led, or maybe you've just had an influencer position and you're proud of the work you've done, then you better develop a leadership strategy to build the next generation. So as a mom and a co-founder of ADAO, it's my job to turn the baton over to some qualified people going forward. So I take leadership, development, and internship really seriously so people can understand. I don't want any of our stories to be lost. Not mine, not Michael Bradley's, not Felix's. I mean, there's so many. And it's through the next generation that we will truly manage this. I won't live long enough, not being depressing, but if diseases take 10 to 50 years to present, I won't live long enough to watch this whole man-made disaster end. So I think we have a shared responsibility to do what nearly 70 other countries have done, which is ban it. And Missy, when we talk about banning asbestos, and you're great, you come to my conferences, people are really confused. Like, did we really get a ban in March 24? Why isn't it in the courts again? It's the same courts that overturned it in 89. It's like all this confusing stuff. The average person, one, they're too busy and it's complicated. And
Absolutely.
they don't understand. So I often get with, wait, why are you still having this week of awareness? Didn't the EPA ban it? Diplomatically, you have to pull back and try to explain it was a landmark step forward. 1 fiber, 6 conditions of use. Thank you, but we need to move on to all fibers, a comprehensive ban, all uses. And I, frankly, as you would expect, I added 2 extra fibers to the mix. It's winchite and richterite. So it's 8 fibers in the Linda Reinstein Ban Asbestos Now Act. I would like people to think about as for the hundreds of thousands of Allens. It's not for one husband who I miss very dearly. It's for all the people who I've known, haven't known, maybe one day might suffer from. But that bill represents Americans, the true
Absolutely. And I love that you're talking about the bill. For those that don't know, the ARBAN bill is the Alan Reinstein ban for asbestos. Linda has advocated very hard for it. And how do you think that the timeline of that ban reflects both progress and the challenges achieving a full asbestos ban?
Well, that's the $1,000,000 question.
Okay.
So, people look back and say, "What happened in '89? Why was it
Mhm.
overturned in '91?" So, I think when you work on public policy and public health, being a student of history, an active student of history is really important. So, looking back at what happened, how did they get away with overturning it? And you look at the law, and industry is obviously well funded, and they are able to use the law usually for their position.
Mhm.
And you look at what has happened in the past so you can model a successful policy and legal action going forward. So, has it been easy? No. And I often say, what is easy isn't always simple. And this, I mean, asbestos is like the poster child for that. So, along the way, I weave in, as you would expect, Missy, I
Yeah.
play like four-dimensional chess. I
Mhm.
move this over here to get to here. I know what I want. I know my goal is very clear, and how I'm going to get to there is going to be multifaceted. So, what makes ADO unique? And I'm hoping that other people can use it for autism and other issues, maybe that impact their family or their communities, is you have to have a dual track strategy, sometimes more than two tracks. And weaving together the science, the evidence, and the law allows you to have a conversation and move change forward. If it is only about sad stories,
Mhm.
people lose interest. If it's only about the law, they're like, wait, why haven't you done this before? Right. So it's a really hard issue, but wrapping your arms and and your head around a dual track strategy or more has enabled us to do this. So our band started as what's called a marker bill.
Right.
One day, I'll write the pull back the curtain story of what really happened, the friends and the foes that
Mhm.
impacted the bill. But it started as a marker bill with Senator Boxer. And little by little, then Senator Merkley and Bonamici came to the front. And I'm really proud to say, after all of these years of us fighting collectively, we have bipartisan support in the House. People understand asbestos is there replacement fibers that can be used for the chlor-alkali industry and other issues.
Mhm.
So we don't need it anymore. And if you are going to use it, you're probably going to end up in court. And it'd be my greatest pleasure to turn evidence over to a leading law firm to make that happen. So industry has really shifted their position. Um,
Yeah.
they know there's no safe level, whether they'll tell me that in person.
Mhm.
I about 3 years ago, I had this funny call, and it first started as an email, and I thought it was like one of those Russian brides or Nigerian prince. It was the CEO of Olin, and he wanted to talk to me about ARBAN. I thought it was I was being pranked. Little by
But you weren't.
little by little, we connected on the phone, and Olin was the first industry supporter of ARBAN, and they have been phenomenal. They have been strong in offices, and they support ARBAN. What you see, or what maybe some people don't see, is there's a lot of positioning going on. Like if you say you support the 2024 EPA final rule,
Mhm.
mean that science carries over to the other 9 chemicals that are being evaluated? The answer is yes. So
Yeah.
asbestos became a precedent-setting chemical for the
Mhm.
Lawrenceburg bill too. So there's so many different layers, Missy. I think at the end of the day, your viewers and people that I meet, they just want to know, what is it? Where is it? What do I do? They want to know
Absolutely.
the level of hope. They want to care for their families.
Mhm.
I don't think patients start out seeking justice. I think that is a byproduct of the more you learn. And I
Absolutely.
like people to know that, see, and just to be clear for any viewers, ADO does not make plaintiff referrals. We do not engage because we want to be an independent organization and
Mhm.
remain that way. But I think seeking justice is important. That's how I get more information, is by reading transcripts, through discovery, through holding companies accountable. Nobody comes to the front of my door and said, "Oh, this is so terrific. Let's just ban it today." I mean,
Yeah.
I've had to fight for every step across this river. Every dry stone I've put my foot on, I've had to fight for. But it's a fight I'm willing to have for Alan and those I know, because it's important that we all fight together.
Yeah, and it's been really cool to watch you throughout the years because, like I said at the beginning of this podcast, like I met you probably 15 years ago, and I got to see you at a conference in California. And just listening to you, and you had like doctors there, you had people about banning asbestos. Like it was a really cool thing, and patients attended. I was just blown away by the amount of people who are in this industry, like from patient to doctor to people in Congress, and you like brought them all together under one roof to come up with a solution, which I thought was very inspiring. And you had mentioned about the EPA, and I was just wondering, what lessons do you think can be drawn from the EPA Part 1 crystal rule timeline that you guys had? And then also for the EPA Part 2, the risk management timeline, what do you think is critical to understanding ongoing exposure risks in the U.S.?
Well, the important part is, don't accept what you read the first time as the truth, and you have to
Mhm.
dig, and you have to be supportive, and you have to change your position. I also think accepting steps forward, whether it's a so-called landmark step for diplomacy or outright opposing, I do both.
Mhm.
I think persistence and passion and tenacity are important. You just can't give up. And I remember when the 2024 March final rule was actually announced, and I was asked to be involved, and I declined because it was only going to be one fiber in a small set of conditions. I didn't
Mhm.
want to add more chaos. I remember crying to my daughter Emily, and she said, "Mom," I said, "I'm getting calls from around the world and text. People are like congratulating me, and I know the truth is it's not a comprehensive ban. It's going to be overturned in courts." And she
Mhm.
said, "Stop. Dry your eyes, take a bow, wake up tomorrow and get back at it." And I'm like, well, that was easy for her to say, but it was true. I think when you look at different steps for policy and the law across the way, you might not make it across in the first run around the lap. If you're running a marathon, maybe you don't finish 26.2 miles. Maybe
Mhm.
you do a half marathon. So I think set out with a tight goal and a focus, be collaborative and respectful. Gratitude is the best currency you can use in Washington and beyond. And set goals that are reasonable, and don't give up. You
Yeah.
have to show up. I tell people, like some of my colleagues, they might be environmentalists and they might be, not very pleased at what the industry is doing or
Mhm.
other new action. And I said, you got to show up. If you're a stakeholder, show up at the table. Maybe it's not the dinner you want to have at that moment in time, but you got to show up. And I think that's probably one of the leading lessons with ADAO. We have never given up, even through adversity and hard times and financial hard times and human resources are lean. We don't give up. And I
Yeah,
think
you never have.
no, but I think that's an important message, and it's everybody coming together. I hope people, when they watch this podcast in a few days, we can give them a teaser now. Right now, I have multiple phones on my table. We're working on actually announcing the passage of the 21st Senate National Asbestos Awareness Week resolution for April 1st to the 7th. That's a pretty big deal right now when the
It's
government
a
can't figure.
huge deal.
It's a huge deal when the government can't figure out how to fund TSA agents, and I take that
Mhm.
seriously. But we look at what has happened. So I hope your people look like, wow, Missy had a great conversation, and look, she had some news, because that resolution that's going to pass ideally today is the cornerstone of Global Asbestos Awareness Week. We weave all the facts together. So anything is possible, and never give up. That was always a Reinstein motto. Reinstein's never give up. So I'm in it to win it, whatever winning looks like. I want to make this go away for myself, my daughter, and the future that we all share.
And we are completely rooting for you, and Emily, of course. Speaking of Washington and the White House and stuff, it was all over the news about the White House East Wing demolition. And what do you think about that with the transparency, oversight, and accountability of that whole project? Because I know we get lots of questions coming into our organization, people wanting to know how this is going to affect them. You know, are they going to get sick because they live around the White House? And, you know, is it going to go in the air? Like, what do they need to know to protect themselves?
Yeah, so that's a strong issue that I've been working on. Of course, we're having to use the law for that also. So I think you probably also felt similarly, like it was the third week in October, the 21st, and it's like WTF, it's Tuesday, and I'm seeing the East Wing just demoed to the ground. No, we had heard conversations about it, but it was like in the cloak of darkness, all of a sudden it's gone.
Yeah.
And then I wrote a letter to the White House asking, like, did you follow NESHAP, which is a government regulation? Simple question is like, did you do an inspection? Do you need to abate? Did you notify the staff? And where did you dispose contaminated materials? In sort of that framework.
Right.
Nobody's bothered to answer. So, of course, we keep at it. ABC, it has worked with me on this story, and so have others. But if the White House doesn't follow government regulations, why should a builder in Florida or someone in California?
You make a great point.
If it's cheaper to do it wrong and pay the fine, then you don't have regulations. The White House feels they're above the law. It has been a brutal fight. And I put together about 12 different FOIA letters, Freedom of Information Act. So I asked those like 4 elements. And guess what? Nobody wants to tell me. So we're going to take the government to court for this also, because if the Freedom of Information Act doesn't give you the information from the government, then that's about as helpful as a government regulation that you ignore. So the purpose of these cases all build on transparency, accountability, and responsibility. And no, we're not giving up. Just because you're in the White House doesn't mean you have, carte blanche on all of this. But it is hard. And I think, I don't know how you feel, Missy, but I feel people are becoming almost despondent that the challenges every day are so great that we all like have PTSD.
Yeah, absolutely.
And it's very hard to stay persistent and clear-eyed, but ADAO's not giving up. It was wrong to, if you demolish the East Wing without doing the proper inspections, abatement, notification, and disposal, then guess what? You're wrong. And I look forward to holding the government accountable, because that's not right. That means we're leading the race to the bottom. And there are people that are really frightened, people that walked around the Treasury building.
Yeah.
And I have to tell them, I want to reduce fear, but be honest. And I say that the latency period for an asbestos-caused disease could be 10 to 50 years. So our best recommendation is have a conversation with your physician, note it, understand the early warning symptoms, and go back to living your life. Because you can suggest a baseline x-ray, but nothing will show up. So trying to educate people along the way on what can you expect, what should you do, and we're going to address that at our conference coming up, is take real world experiences to the medical community, where we can educate doctors and patients and those exposed, so people know what to do, because it is terrifying. It's terrifying. We once did product testing, and a kid's toy was confirmed with Tremolite and Chrysotile.
Yeah.
And parents were calling and crying, and they wanted to know if their child would get sick. I can't totally diminish that concern, but it's knowing what the symptoms are.
Yeah, I'll never forget when they released the story on asbestos being found in crayons, and the amount of phone calls that I had to field with people just so nervous, and especially parents whose kids love to eat crayons. Like, they were terrified. But I did feel that a lot of times people don't get involved unless it actually affects themselves or somebody they know or somebody they love. So talking about the White House East Wing demolition and talking about like asbestos found in like kids' makeup, kids' crayons, like it's a very important conversation. You may think that this is not going to affect you, but the truth is it is affecting all of us. It's just, are you going to be the lucky one who it doesn't take one of your loved ones away or take you away from your loved ones? Nobody wants to see anybody get this disease, even if it's just asbestosis or, a pulmonary type disease. They're all awful. And I'm really, really eager to see how the Global Asbestos Awareness Week really helps our young youth, get behind it, understand that there still are dangers. And I hope that organizations like you are able to inspire them. And by us getting this message out, individuals, organizations, policymakers, all the stuff that you at ADAO, how you have a mission to prevent exposure and eliminate asbestos-caused diseases. Like, it's just remarkable. Is there anything that you want to tell our listeners about the Global Asbestos Awareness Week and how they can join in to help make a difference?
Sure. So use technology, throw up a TikTok, incorporate the hashtag 2026 GAAW for Global Asbestos Awareness Week. So spread the news, share a fact, use some of the social media platforms. Check out our website, of course, ADAO.us. I'm sure you'll put it up on the screen.
Yep.
And you don't have to make it your life's mission like I have and you have, Missy.
Yeah.
People can share one fact and make a difference. They can send a letter through our website to their member of Congress.
Mm-hmm.
They can share their story if they've been impacted. Nonprofits always need donations. They can also make a modest contribution. But I think recognizing we're 70 other countries nearly have banned asbestos and we haven't. So if everybody steps up, we can get the Linda Reinstein bill through, protect all lives, and lead by example. So there's something for everybody to do. And I look forward to helping you, Missy, fight the right thing for your organization. We do. Because technology, as you have kids, my daughter's now, technology is the voice.
It is.
We used HeyGen to translate an invitational video that I did like on my couch. We translated it into Portuguese, Spanish, etc. My daughter is very critical when I use AI because she can always usually pick it up. And she said, "Oh, Mom, your lips move. They're in sync and your Spanish is beautiful. And you don't speak Spanish."
I need Emily to help me with that so I can speak Spanish too.
So we used a leading platform to translate our videos. So, join us, translate, share a message. It should be fun. If it's all drony and terrible, then it's hard to share a fact about a life-altering invisible fiber, but we can do it. And there are elements that can be kind of cheeky and creative. And I love what the youth, I'm sure your kids do it too. They're so clever with their phones and their technology.
It's so clever. Isn't it? It is. It's amazing. Well, I can't thank you enough for being a part of our podcast. We aim to educate people, and you've done a great job helping us achieve that mission today. And I hope for anybody who's listening, if you really want to get behind a not-for-profit organization who helps everybody in the U.S. by helping, lobby and pass laws to help ban asbestos in the United States, ADAO is your place. And Linda, you are amazing and very inspiring. And again, I cannot thank you enough for taking the time out of your busy day with your 4 phones and everything going off to take the time to speak with me today. And I very, very much value your friendship. And again, I can't thank you enough.
And thank you for the opportunity, because every message we share together does make a difference, Missy. Thank you.
Absolutely.
Have you or a loved one been exposed to asbestos? You may have legal options. Contact the Mesothelioma Center at asbestos.com or call 833-628-8546 to reach one of our patient advocates today.